The Congressional Budget Office has come out with its score for the Republican healthcare proposal, the AHCA. So everybody's wondering how many people are going to be kicked off insurance. Hey, you know what? The Republicans and Donald Trump told us nobody's going to get kicked off insurance. Everybody's going to have insurance, and it's going to be lower price for everybody and more coverage. And you're all getting play boxes for Christmas. Okay. Play boxes? PlayStation, Xbox? You're getting both! Okay, anyway, you get a car, you get a car. So it turns out, not true. Of course! How many people are gonna lose insurance under the new Republican proposal? 23 million people, okay? So, now, I want you to be clear about this. Some people call this Trump care, but no, the entire Republican Party is in favor of this. They're the ones who passed it in the House. They're the ones who crafted it. In fact, they made it more draconian than even Donald Trump wanted. The Tea Party guys in the House were like, no, we want more people kicked off of insurance. Why? Because they wanted even more tax cuts for the rich. Oh, great. So I'm gonna tell you all about that. First, the Congressional Budget Office is nonpartisan. So they tell you what the bill is gonna do, the good news, the bad news. So they had some good news here too. They said, the agency also predicted that the deficit would come down by $119 billion over the next decade, and that premiums for people buying insurance on their own would be relatively lower than those premiums would be if the Affordable Care Act stays in place. Well, that sounds pretty good, right? Hold. Now let me tell you why some of those premiums are coming down and why you have the deficit reduction in the first place. So prices would come down for the healthy people, because those who are sick or have illnesses in their medical histories would have less access to coverage. And the policies available on the market would tend to be a lot less comprehensive. Well, yeah, it'll cost less if it doesn't cover you when you're sick. So that's not really an insurance plan. So the states could take away your coverage if you have a pre-existing condition. So we're back to the bad old days. They could put caps on how much insurance companies have to spend on you per year or your lifetime. Well, if you have a cap and then you get cancer and they're like, oh, well, I'm sorry, man, you breached your cap, that's over $12,000. So I guess from here on out, you die. Yeah, those are the things we were trying to get rid of. And yes, insurance costs a tiny bit more if it is actual insurance and covers sick people. If it doesn't cover sick people, then it'll cost less, but it'll also be useless. So one of the changes that would allow the states to waive a rule that prohibits insurers, as Huffington Post explains here more, from charging higher premiums to people at greater risk of medical problems. So in the old days, they could charge you more if you actually could get sick. Now we're gonna go back to those days. Without that rule in place, insurers could jack up rates for people with pre-existing conditions, effectively making standard coverage unavailable and violating a key promise to guarantee insurance for everybody regardless of medical status, which most Republicans had endorsed. So when they told you that everybody was gonna get covered, total lie. When they told you that, well, first of all, 23 million people are gonna just lose insurance, no insurance at all. Second of all, if you have insurance, do you? If it's got a lifetime cap or it's got a yearly cap, or if you switch jobs or you switch insurance for any reason, oh, sorry, some of the states said, we don't have to cover pre-existing conditions anymore, so you were sick once, we're not gonna cover you anymore. Or if you're older, it's gonna cost you way more. Sometimes as much as 4 times what it used to cost. On top of everything else, this is a political disaster for them. If it gets implemented, if the Senate passes, this is the House version, it's at the Senate now, and President Trump signs it, and you then have older voters who are getting charged 4 times what they used to, it's gonna be a political bloodbath. And it should be, because without insurance and the ability to afford insurance, well, then you have a literal bloodbath. When you say to people you don't have insurance anymore and they get sick, they keep saying, oh, I mean, what do you mean? They got coverage, they can go to the emergency room. Yeah, if you break your ankle, you can go to the emergency room. If you've got cancer, you can't keep going to the emergency room and getting chemotherapy. That's not how it works. That's a death sentence. It is, in real life it is, there's just no way around it. Like they're a little too afraid to tell you that on TV because it sounds impolite. You know what's impolite? Giving somebody with cancer a death sentence because they can't get insurance anymore, they can't afford insurance. That's really, really impolite. Now, how about the good news on the deficit side? First of all, did you know that Obamacare also reduced the deficit? They never talk about that, but it did. And part of the reason that they made sure that this one also reduced the deficit was so they can pass it with just 50 votes. It's a complicated reason on reconciliation and how the Senate works, but you can't filibuster it, or there's a potential that they can't filibuster it if it actually reduces the deficit. If it added the deficit, then they would need 60 instead of 50 votes in the Senate. So that was one of the reasons they did it. But there's a more important thing behind the deficit. They explain here at HuffPo, there's no magic behind the bill's effects on the budget deficit. The House approved a measure that slashes federal support for low and middle income families to obtain healthcare coverage. So, like, yay, it's less of a deficit than we used to have. Well, how'd you do that? Oh, I made sure the middle class didn't have insurance. So before, there was $800 billion extra in Medicaid. So if you're poor or middle class, Medicaid covered you. Now they're taking that away. They're taking away $800 billion. So that's why 23 million people won't have insurance anymore. So hey, I solved the deficit problem by not giving you insurance. How do you like my healthcare plan now? And one more wrinkle here, which is very, very important, and the whole point of why Republicans are doing this. Most of the money saved by cutting hundreds of billions of dollars from Medicaid and billions more from financial assistance for those buying private health insurance will be transferred to wealthy households and healthcare companies in the form of tax cuts, with a small amount left over for deficit reduction. So the money saved isn't even mainly going to deficit reduction. That's a tiny amount of it. No, most of the money saved is going to the very rich and corporations in the form of tax cuts. That's what this Republican healthcare proposal is about. It's not about healthcare. It does the exact opposite. It covers less people, makes it more expensive for people who actually need it, and sets all of these barriers to actually getting coverage. It's not about healthcare. It's about tax cuts for the rich. This is Republican 101. Next time you vote for a Republican, don't get surprised. This is exactly what they do. They serve their donors. Their donors want those tax cuts no matter what, even if it costs you your life. That's the reality. Membership helps fund the Young Turks. You know one great thing about that? That means we're not accountable to anyone but you guys. That's why we're strong together, because we built this show around you. Come build it even bigger and better at tytnetwork.com/join.